Hello, and welcome to this brief demonstration of the newly redesigned HealthyADK.org. I hope to provide you with enough information about the website for you to feel comfortable searching for and using the resources and tools within the site. For the next 30 minutes or so, I'll walk you through the key features of the site and answer some of the more common questions that visitors to the site tend to have when using the features. So let's begin with the homepage. The first thing that you'll notice if you visited the previous version of the site is a new, larger, interactive rotating carousel. Each slide within the carousel includes a shortcut to a specific area or feature of the site. So as you can see here, the rotating carousel is moving through 4 different slides. So this particular slide here would bring you to the Explore by County page, which can also be found here. The next is Quarterly Health Observances, which I'll come back to in just a moment. The next is the View All Data, which would bring you to the All Indicator list, which you'll find under here. And then finally, you have View Priorities, which if you click on this one, would bring you to the same place if you clicked on this up here on the navigation bar. As you can tell from 3 out of the 4 slides, there are multiple ways to visit different features of the site. With the exception of this particular slide here for the Quarterly Health Observances, this is actually the only way that you can visit that particular page. So if you click on it, and any of the slides within the rotating carousel, you can access by clicking anywhere within this field. It doesn't have to be on top of this box here. So we'll click on this particular one. And this brings you to Quarterly Health Observances, which are basically monthly health observances within a quarter of each calendar year. So this particular quarter will feature October, November, and December. Each of these is just a brief description of that particular monthly observance, and then you can click on either the picture or the Learn More to go to a different site that will talk about that particular health observance. At any time that you want to move back to the home page, all you have to do is click on the logo up at the top, and it will bring you right back to the home page. And I'll get to the other areas that these slides cover in a couple of moments once we get to the navigation bar. But for now, let's scroll down. So here in the middle, you have initiatives that are covered by the North Country Population Health Improvement Program, also known as the North Country FIP. So you have Healthy Community Design, North Country FIP Health Reports, and Tobacco Nicotine Reduction. In this area of Healthy Community Design, we have featured some resources that further describe healthy community design, some projects that have been completed by community partners within the North Country back in fall of 2018, and in the future, we'll have some information about some projects that are occurring now. We also feature our Healthy Communities in the North Country infographic, which if you click on this, it will bring you to a PDF that you can print. And then we feature some other infographics on healthy community design. In this situation, it happens to be the Change Lab solutions, but we hope to feature others as they become available. So moving back up to the top. Again, clicking on the title or the logo, either way, brings you back to the home page. Here within the North Country Health Reports, that's where you can find the other infographics, as well as the one that I just showed you, the Healthy Communities in the North Country. Each of the infographics that have been created as part of the North Country FIP work can be found here, as well as a regional interactive map and 2 health reports that were published within this year. So again, scrolling back up to the top and clicking here, to go back to the home page. We have the tobacco and nicotine reduction area. And this is where you can find information on tobacco use reduction, tobacco use burden, T21, the Clear the Air flyer, and some community resources. Again, back to the home page. And we'll move down. Here you can find a quick link to the New York State Department of Health prevention agenda for 2019 through 24, as well as links to our Adirondack Health Institute partners, ADK Wellness Connections. And you can either click on here or the logo. So that covers the home page, and now we'll move on to the navigation bar. So as I mentioned before, if you were to click on the second slide of the rotating carousel, which is view priorities, it would also bring you to the landing page for health priorities. So if I click right on health priorities, it brings me to this landing page, which covers the North Country FIP health priorities, tobacco use reduction, chronic disease prevention and management, physical activity, and access to healthy and affordable foods. Any of these that you click on, they're all set up exactly the same way, and you can either click on Learn More or on the picture. So in each of these topic areas, you'll find data, promising practices, and resources. And in each of these areas, if you click on them, they've been pre-filtered to the particular topic that you happen to be in. So in this case, access to healthy and affordable foods, if I click on data, the indicators within the site have already been pre-filtered for access to healthy and affordable foods. And it follows the same for each of these areas. So you can see this is set up the same way for tobacco. If I click on data, it's been pre-filtered. Promising practices have also been pre-filtered, as have the resource section. It's just a little quicker way for you to be able to get to the indicators that you're looking for if they happen to be in these particular areas without having to search through all of the indicators. So that brings us to the Find Data tab. Under this tab, you'll find the following: the data request form, which you can use to request data from the North Country FIP team or the Adirondack Health Institute data team. You have search for data. This tab will bring you to the all data page. This is where you'll find all of the indicators on the site. You can search for data by location from this page. So here it's already set for North Country. I can also search for county, population health network, census place. There are quite a few, so bear with me here. But you can see that you can click on any of these locations by zip code. And again, there are quite a few. And census tract. Just note that not all indicators have all of those options. Some indicators are only for the North Country, while others you can choose all of these, and then there's many that are in between there. So some might cover the North Country and the county, and some might cover the North Country, the county, and a zip code. So just be aware of that as you're looking through the indicators. But I'll show you a list that you can access that will help give you kind of a snapshot of where the indicators, how the indicators are located geographically. So from here, you can also click on any of the indicators to learn more about that particular indicator. So if we click on adults who have had a routine checkup, you can see right away that this is a type of a clickable resource. So if I click on that, that will bring me right into the details of the indicator. Again, here I can change where I want to do that search. For this particular indicator, it's only for the North Country or the counties. Anytime you go within an indicator, the regions that that indicator covers will it'll only let you access the regions that that particular indicator covers. So here I can either choose North Country or I can choose the counties. It also gives me the ability to choose different measurement periods if those are available for that particular indicator. Some have more, some have less. Each indicator usually has a why is this important? So this paragraph here, it tells you what you're looking at. So for right now, we still have it set for North Country. Here are some comparisons to different other data. Here's your source, which again, you can tell if you click on that, it'll bring you directly to that source. Tells you the measurement period. Here's the conduit HCI. They maintain the site for us and update all of our data points. Here's the last update. Here's a trend line, an area where you can download the data. Here you can switch from region to county. Again, here's your data source. Here's the methodology, which is important for folks who want to be a little bit more in depth with that information, know where it comes from. And there are always areas at the very bottom that talk about related content. So here you can find other indicators that might be related to the indicator that you're within, any promising practices, reports on the site, funding opportunities, featured pages, and any health plans that are within the site that also might have this indicator within that plan. Each indicator will be set up in a similar fashion. So going back to search for data. As you can see, these also give you a quick glance of those comparisons that you saw a minute ago when we were within that detail. You also have a legend over here that you can click on. It gives you a little more information about what you're seeing. And then you can hide the legend again. And you can also go to the search for indicators, which is where you're able to build a customized dashboard or to just do a search. So for example, if I wanted to look at that same indicator, adults who have a routine checkup, and I wanted to look at it for Clinton and Essex, I could then click search, and it will give me that information right here. So that's how you would build a customized dashboard. There are also curated dashboards. These are dashboards that were previously created by administrators of the site. Okay, so the next thing that you'll see within this Find Data tab is the All Indicator list. As I mentioned before, this is a list that just gives a brief snapshot of where geographically each of these indicators provides information. So again, adults who have had a routine checkup, we can see here that we can find regional data and county data. Adults with health insurance, we can find only by county. Then if we keep going, other indicators start bringing us with some other information. So age-adjusted ER rate due to diabetes, you can also find by the Population Health Network and zip code. Here, teen birth rate 15 through 19 is region, county, and zip code. So this is just a nice list to be able to briefly glance at just to see how many locations you can find information about for a particular indicator. And if you go into this list and just right-click with your mouse, you can print it and just have a hard copy, which is kind of nice. So that is the all indicator list by location. And again, you'll find that under the Find Data tab. You also have Explore Data, View Measures. This tab will provide you with several choices of dashboards that break down the data by specific pre-filtered information. So for example, the Healthy People 2020 Progress Tracker, there's a demographics dashboard, disparities dashboard, the socio needs index, and prevention agenda tracker. And finally, under this tab, you have a Help Center for Data and Dashboards tutorial. This is a link to Conduent HCI's website where you can find tutorials on how to use the features of HealthyADK, specifically in this data and dashboards area. So then we have the Explore by County section, which is a new section. If you click directly on Explore by County, this will bring you to a map, again, which is interactive. Once it loads, I'll show you what it does. Okay, well, it looks like it wants to be a little finicky. So what it actually does is it brings you to a map that shows you each of these counties that you can also find under the navigation. And you can click on them using that map, or you can just come down through here and click on the particular county. The counties that are covered are part of the North Country FIP area, as well as our Adirondack Rural Health Network area. Each of the counties are broken down in 4 subtopic areas. So you have priorities, partners, data, and resources. So I'll just click on one just as an example. So if we come to the Clinton County page under priorities, each of the counties has a picture and a quote provided by representatives of the county. Down here, you'll have some links to PDFs of the community health assessments and community health improvement plans. A link to the prevention agenda of 2013 through 17 with an extension into 18. These are the prevention agenda priorities for, in this particular situation, Clinton County. Again, these were the prevention agenda priorities that were chosen for the last round of the prevention agenda. Each of the counties are in the process of updating their priorities for the new 1924 prevention agenda. So the website will be updated once those are chosen. At the bottom of each of the county pages, you'll find some navigation tools. This just makes it a little easier to get to so that you don't have to scroll to the top to move to each of these subtopic areas, which is nice. As you could tell from the other areas, we needed those in those other sections. So from here, I can go right to partners, which again, if I was at the top, I could find right here. So in this particular situation, these are partners that were identified again through the community health assessment and community health improvement plan process. And again, I can click on data right from here, or if I wanted to scroll up to the top, again, I could click on it here. So much like the health priority section where the data was pre-filtered by topic, the data here has been pre-filtered by county. So each of the counties has a pre-filtered dashboard. So in this particular case, Clinton County dashboard will bring you to the indicators within the website that have already been filtered out for Clinton. So before, when I showed you on the indicator list that some of the indicators were for a particular county or region or zip code, if they were filtered out by county and Clinton County had information within that indicator, since we're in the Clinton County page, you would find that here. Let's go back to data. You can also get to the prevention agenda tracker, some demographic data, and socio-need index data. Again, these are all pre-filtered for Clinton County. You have a data at a glance, and again, each of the counties has the exact same format. I'm just showing Clinton as an example. So again, here you can find certain indicators. Here are some comparisons. If you click on Learn More, it would actually, in this particular situation, I have adult smoking here. So if I click More, it actually brings me to the detail page for that indicator. You have some quick links to more data resources, and again, the navigation at the bottom. So we'll go to Resources. This brings you to the resource library, but again, all of the resources on that particular page have been pre-filtered for Clinton County. Since again, we're using that as an example. As you can see, for each of the counties, you have the same 4 choices, and they're all set up the same way. So then we come to Tools and Resources. Under the Tools and Resources tab, you'll find the first is the Resource Library. This tab will take you to the main resource library. Once there, you can filter your choices down by resource type, topics, subtopics, date range, or location. Under the resource library is where you'll find all of the resources contained in the site. So if I click on one, just to give you an example, here's fruit and vegetable consumption, which is a brief report provided by the CDC. It gives you all of the information about that particular topic or that particular resource. I can view and download it here. And again, like before, it gives related content. So if there are any indicators that have something to do with this particular resource, I could click on any of those here. Here are some toolkits, maps, and just other features within the site. I can also access some collections that we have created that we just thought would be useful. Or you can go right here, and this is the North Country FIP resource collection. So it's the same collection that you can find either here or under here. And these are just topic areas. Again, it's just a way of pre-filtering particular resources for these topic areas to make it a little quicker and easier for you to find. You also have promising practices, which have been pre-filtered by category. Tools, which is where you can find the location report builder, and a guide on the community health needs assessment. Finally, you have the About Us tab. Under this tab, you can find information about the North Country FIP, as well as other population health improvement programs in New York State and the areas that they cover. Down here you have their logos. They're also clickable so that you can find them either by clicking down here or by going directly to each of their titles here. You can also find information on meetings, a little more background information on what population health is, and also some information on HealthyADK. Here you have frequently asked questions. These are brief bits of information to help guide you through the website. You have general questions, data questions, site features, and support. A couple things to look at under general. Where can I find similar information for other counties? It also brings you to that same list that I just showed you a minute ago. And then another one that I'll just highlight, where does the data come from? This also brings you to a list of indicators by source. So you have two different ways to view the list to take with you if you wanted to print them off. One was the all indicator list by location, and then this one is by source. So if you wanted to know how many indicators we had on the site from the American Community Survey, for example, you could click here and it would tell you those indicators and tell you how many were on the site under that particular source. And finally, you have the contact us page. Provides our address, phone number, a direct link to email, as well as the county health departments within our covered area. And then just last, but certainly not least, we have the blue navigation bar down here at the bottom. These, again, are pre-filtered topics that you can click on. So if we click on health, for example, anything on the site that is related to health, you can find here. So any indicators, data resources, toolkits. If it was somehow flagged as being health related, it would be under here. As another example, transportation. You'll see there aren't as many choices under here, but still, if there was anything on the site under reports, promising practices, or indicators that have a transportation feel to them, you could find them here. Similar with social environment, public safety, government politics, environment, education, economy. Again, it's just a nice, quick little way of finding information without necessarily having to do an overall search of the site. And then you also have, again, the About Us, frequently asked questions, and our contact page. So there you have it. That is the redesigned HealthyADK in a nutshell. Hopefully it provides you with enough information for you to be able to get around on the site. If you have any questions as you are looking at the site, you can always go to the contact us, send us an email, or give us a call, and we'd be happy to help you walk through it a little bit more in depth. Thank you very much for viewing the webinar, and I hope it provides you with enough curiosity and interest to go onto the site and do some exploration of your own. Thank you very much.